how do you respond to people who are saying it seems that you're minimizing the elderly and those kind of more high-risk groups when you say that?
I respond by saying I'm doing exactly the opposite. I'm saying that we must focus our efforts in a real way on defending the most vulnerable, and that is particularly the elderly and those with certain health conditions who are uniquely vulnerable. The reality is that across the world, the overwhelming majority of those who have been hospitalized and died because of COVID-19 are seniors, and as I've said, the average the average age of those who have passed away because of this coronavirus in Alberta is higher than the average life expectancy in our province. And so those are the folks we must focus on most to protect. And here's my point. I know that in the fall, when we come back to reopen the schools, there are going to be some voices saying that in the absence of a vaccine or some widespread medical treatment for COVID-19, that we're somehow jeopardizing the health of kids. And what I'm trying to do in part is to reassure people that, yes, it's true that we have seen the COVID-19 has affected the health of some young people, but a tiny number. And relative to for example, other kinds of health threats that younger people face. And so my point is that we can do things like reopen the schools with appropriate public health guidelines, with appropriate sanitation, with trying to do things like spacing. We all need to continue to follow those general health guidelines, but what we must focus on is protecting the most vulnerable. And that is why Alberta's government announced our $172 million package to support continuing care and other congregate seniors facilities to protect them from the pandemic. And that's where the focus must and should be, in particular in the future.